of the United States, I think many of you have been watching it either on your nightly news or in the newspapers or on the web, and you see that many states in California are experiencing high increases in case rates. The governor talked yesterday about test positivity in parts of the country that go as high as 25, 30% test positivity, largely in states where they're often testing the most symptomatic or only symptomatic individuals. Unlike in California, where we do a great deal of testing of those who are either asymptomatic, pre-symptomatic, or not infected at all. So we see that the Midwest experiencing quite a significant increase in cases, but really states right next door to us where they've experienced surge. California, as you've been tracking over the past couple of days, we ourselves have seen increase in cases as well in many parts of our state, something that we're closely watching. And in the backdrop of our tier assignments today really gives that context. I like to think of it as the sort of level of COVID transmission is generally higher in this environment than we've seen over the past many weeks. So what are we seeing in terms of case numbers today? 5,367 reported cases today. I'll remind you that our Tuesday reporting number is really looking at a 24-hour period from Sunday morning to Monday morning. We work through, validate those cases over Monday afternoon into the evening, and then report them today, Tuesday. So this reflects Sunday data that is often lower in terms of the number and reported. You saw in the previous couple of days where we've had case numbers over 7,000 statewide. Altogether, that's why we look at the 7-day average. Over 6,000 cases is our 7-day average. Total test and test positivity, we've seen an increase in test numbers, 176,000, over 176,000 tests done. And then our 14-day test positivity is 3.7%. I'll tell you, we also track the 7-day test positivity, which is 4.2%. We hadn't seen test positivities above 4 since the end of August, early September, just in terms of context of where we are. So 14-day test positivity, 2.9 back in October. Today, just 2 weeks later, 3.7. Similarly, we talk about hospitalizations and ICU numbers. I'll just also remind you or tell you for the first time, some of you, the trend that we've seen as we continue to learn about COVID transmission is when we identify cases today, we expect to see some of those cases, approximately 12% of the cases, end up being hospitalized 14 days later. So between 14 and 21 days later. So today's cases become hospitalizations 2 to 3 weeks out. And so it's important as you look at today's hospital numbers of 3,083, which represent 31.6% increase over the past 14 days. These really higher number of cases that we've seen over the next few days won't manifest or won't become patients in hospitals for another 2 to 3 weeks. Similarly, we know that the ICU hospitalizations have increased, currently at 859. That's nearly a 30% increase over the last 14 days. And we know that patients hospitalized today with COVID, if they need ICU level care, often need that within the first 7 days of hospitalization. So as we see that hospital number creep up because of the case number that's gone up, we also know that we'll see an increase in ICU hospitalizations. So we have spent quite a bit of time speaking about all of the things that we should do to reduce our risk. We wanted to take a moment to discuss what are the higher risk or high risk situations. So one thing we know that activities where it's difficult to mask the whole time, so for example, eating and drinking, create a higher risk for COVID transmission. Similarly, activities where you see people who you haven't seen recently, so people outside of your household, also create a higher risk situation. And I'll just say, we often feel this the most with people who we're close to, so extended family, our closest friends. But even if we haven't seen them for a while, just because they're close to us personally doesn't mean that they have a lower risk of either passing COVID on to you or having COVID come from you to them. So we want to be very careful, not just with those we don't know from outside of our household, but even those that we know quite well who aren't part of our immediate household. We also know that activities where it's difficult to keep your distance create a higher risk. So imagine multiple people at a small table, either playing a board game or having and sharing a meal. Activities of longer duration, we also know create a higher risk. And activities that don't allow, in spaces that don't allow plenty of fresh air to circulate, also create a higher risk situation. We've talked to you for many, many months about the importance of outdoors versus indoors. This is really one of the manifestations of this point, but also the ability, even when indoors, to have the windows open, the doors open, to make sure that as much fresh air from outside is circulating inside, an important feature of reducing risk as well. So instead of just showing you all the things that we advise in terms of reducing risk, we wanted to show you exactly what those features of activities look like that increase risk of COVID transmission. So this is a curve that I'm going to walk you through. We're going to use this more and more in the future, and I'll explain why in a moment. But the point of this is to show you exactly how some of the points made in the previous slide actually manifest in case transmission across California. So this is California's epidemiologic curve. And what we mean by that, it's sort of the scientific way to say how we allocate various cases. And what this shows, each blue bar and the height of the blue bar shows a certain number of cases that are attributed to a specific day. So this isn't the day that the test result came into the state. It's not even sometimes the day that this test was processed or the test was collected. It's actually the day that we believe is the day that that person who tested positive had their first set of symptoms or indications that they were exposed and positive with COVID. So when you look at this curve, you'll see early on the left side, those early March, mid-March and early April days, after we did the first red line that you see going vertically, is did as the state, the first state in the nation to do a stay-at-home order. And we see what was a orange curve, yellow curve that was going upwards begin to flatten. That's our first effort to really flatten the curve. And we did a pretty tremendous job over those first many months of our response to COVID. And then the second vertical line shows when we, after seeing some increase in our openings, an increase in mixing, and increase in cases, when we did statewide our our statewide masking order, which really advised all of our citizens to wear a mask in many, many of the settings outside of their household. And at that point, you see over the next few weeks that we begin to, even though it's pretty steep, that rate of rise starts to reduce, and we start to see us working towards the peak of our first real surge in cases in California. The last red vertical line right around the middle of July shows when we'd seen such high levels of cases that we put more of our sectors that were open indoors, and we required them to close to indoor activities and move them outdoors. So restaurants, some bars in some regions were moved outdoors, others were in other regions, they were closed down outright. So we start to see this move between moving things outdoors, reducing the number of activities where you can't stay masked throughout the entirety of the activity, that those changes were the ones, along with that statewide masking order, were the actions that helped us bring down the curve from those high peaks in the middle of July and begin to move into the really flattened curve that we enjoyed over the last many weeks. You'll see at the very far right, that yellow shaded portion, that the blue bars are starting to increase again, and we're starting to see a number of counties and statewide just an increase in the number of cases. And that is what we are concerned about. That is why we are watching things very closely. And that is why today's announcement, when Dr. Pan announces the tiers, you'll see a number of counties moving from towards a more restrictive tier as we expected and anticipated even last week. So again, this is a reminder we have done a lot together. Over the last 8 months, many individuals across our state did tremendous things to decrease transmission. Many of us wore our face coverings. We've limited our mixing. We've avoided crowds. We've continued to practice those important things like hand hygiene. We've stayed physically distanced. And many of us, when able, have stayed home when we're sick. We know that this is hard. We know many people feel exhausted, they feel isolated, and they're impatient. We talked last week quite a bit about COVID fatigue. I even talk about COVID resentment. We know that this is hard work, but we must do more. Yesterday's hopeful news about effectiveness of vaccines and what we hope months down the road will be another tool that helps us get through COVID and through this pandemic is indeed good news. But we know right now we must do more. The virus is not over just because we're tired of it. It doesn't itself put its guard down. It looks for opportunities to spread. And many of those activities that we highlighted as higher risk are exactly the opportunities for spread that we want to be laser focused on. Invite all of you to be our partners once again in trying to reduce risk so we reduce transmission, flatten the curve again, and make sure we can soon enjoy many of the things that we've missed for the last many months. So with that, I want to invite Dr. Pan up to talk about our tier assignments for the week, and then I'll be right back with you to take any questions.
Good afternoon. Thank you very much. So as mentioned, it's my turn to talk to you today about where we are with our blueprint for California. So as you've seen every week with this structure, we have this blueprint that we had unveiled that outlines the criteria for loosening and tightening restrictions on activities based on the levels of disease transmission that we are seeing, both at the county level and statewide. And as I can remind you, every county is assigned to a tier based on test positivity, adjusted case rate, and our health equity metric. Oops. Let's see, this is the slide here. There we go. Okay, so as you are also likely very familiar with, your county color determines what operations you can do in your county. So just to highlight again, we have the widespread or purple tier, and that's when you have adjusted case rates over 7 and a positivity rate over 8%. You have our red substantial rates and case rates 4 to 7, positivity rates of 5 to 8%, and then the health equity quartile needs to have test positivity rates between 5.3 to 8.0%. And again, we have a moderate range of the orange, 1.0 to 3.9 case rates with the positivity rates 2.0 to 4.9. And again, our health equity quartile needs to be at 2.2 to 5.2%. And then minimal disease transmission in our yellow is less than 1.0 of case rates and less than 2.0% of test positivity. So what we want to show you here, it's actually very interesting to think about that epidemic curve that Dr. Galley showed you and what's happening in our state. And this again really shows us how we have moved as a state with the changes in disease transmission. So we started out and we launched this blueprint for a safer economy at the end of August. And we started out with a really large proportion of our state in the purple tier and the widespread tier. And you can see as we progressed every week that we've opened more and more and progressed more and more counties towards the right, towards the minimal. We look at October 27th, the week of that week, and it looks there like that was probably where we were the most open. We had the least number of counties in the widespread tier that has the most restrictions, and more counties were on sort of the other side of this, and the most counties in the yellow or minimal tier. Just as you saw in that epidemic curve, what was happening around the same time was that we started seeing some slow increases, probably the beginning of October. So as we've seen reopening, which is anticipated, we've started to see more cases and more concerns about increasing community transmission. In addition to our reopening, you've seen as that map that you saw earlier as well of the whole country, and we are side by side with other states and other parts of the country that are having increasing cases as well. So over the last several weeks, you've seen actually that we have had a few more counties come into the widespread tier in the purple. And we're going to tell you which counties today have moved into the different tiers and moved backwards. So today there are 3 counties, Sacramento, San Diego, and Stanislaus County, that are moving back to purple in the widespread tier. There are several counties moving back to the red or substantial transmission tier: Amador, Contra Costa, El Dorado, Placer, and Santa Cruz. And there are also counties to the orange tier: Modoc, Siskiyou, and Trinity. And again, with these increases, we are not seeing any counties move forward this week. So to remind you, and as Dr. Galley mentioned as well, all of your simple acts can make a huge difference for COVID-19, and it will help us prevent the flu as well as we head into the usual flu season. We really implore all of you, wear a mask and maintain 6 feet of distance from others. It's always really important to wash your hands and have good hand hygiene, especially before you're eating. And you again heard all the things that can be high risk, so it's really important to have hand hygiene. That is actually much more important than cleaning surfaces and other things like that. It is much more important to be cleaning your hands, washing your hands before you're touching your face or before eating. And really, really important, as hard as it's been, as Dr. Galley emphasized, is minimize mixing. It is really safest to stay with the people in your own household and minimize mixing with other people. And really important to get your flu shot. I have gotten mine. I've made sure everyone that I love has gotten theirs. Please, please get your flu shot and help protect all of us from flu this season as well. Thank you.
Thank you, Dr. Pond. I want to start by taking the first reporter question.
Ron Lynn, Los Angeles Times.
Hey, Dr. Galley, thanks again for taking our questions. They're super helpful in helping us communicate what's going on.
Great, my pleasure.
Several questions for you. On Monday, health officials in LA and Santa Clara counties said they're now in what they consider a surge. Would you consider California overall being in a new surge or a new wave? Are the main drivers of this surge really small social gatherings and not other things like workplaces? And if it is gatherings, how will you convince Californians to not gather during the winter holidays, given I've heard from a lot of people, some people really want to make this one exception because they feel like it's a long, difficult year. And finally, do you think we'll have to go into more stringent closures than what's currently allowed in the purple tier, or do you think the purple tier is really, good enough in terms of dealing with a surge in cases? Thanks so much.
Yeah, no, thank you for your question. Exactly to your point, we answer, and I enjoy taking time with each of you so we can communicate to the broad public a clear message, a consistent message, and a relatable message. So that Californians feel like they're empowered and equipped with the tools they need to make good decisions and reduce risk. To your question about surge, I think a number of counties are indeed experiencing quite high levels of cases, not necessarily the highest they've ever seen, but certainly compared to the lows we've been experiencing over the past couple months and that downward trajectory, we are certainly seeing almost all across the state an upward trajectory. And so those things, that gives us concern. Is California in a surge? Hard to say, unclear what the exact definition of that is, but clear that we are seeing increased cases. And as Dr. Pan just outlined, first week since we started moving counties forward to less restrictive tiers, that we've had no county move to a less restrictive tier, only a number of counties moving back. And just to reiterate what Dr. Pan was indicating, as we look forward to next week and we see which counties may have missed their current tier threshold this week, we anticipate if things stay the way they are, that between this week and next week, over half of California counties will have moved into a more restrictive tier. And so that certainly is an indication that we're concerned and that that we have to keep a close watch on what's happening, not just because the cases matter. We often use case finding in order to be able to identify where transmission is happening and to bring to bear those tools of contact tracing, disease investigation, and isolation in order to reduce transmission. To the other parts of your question, certainly we constantly look and determine whether our tools and our framework make sense. As the governor indicated yesterday, we feel that the blueprint is working, that exactly at the time we're seeing increases in cases statewide, we are beginning to see counties move to a more restrictive tier. We talk about not just loosening restrictions through the blueprint, but when needed, tightening. So we believe California has a framework that is going to help us get through the next many months, but we evaluate it constantly. A number of counties asked us to look at their data, to take into account certain conditions in their county as we think through that, but certainly because there's generally more transmission, more community transmission, we are certainly quicker to work with our counties to make sure that we don't miss a beat. And if a county does need to go into a more restrictive tier, we do that in a timely way to make sure transmission doesn't get away from us. And we've seen it before where little bits of transmission increases end up resulting into quite radical and what some people call exponential high rates of rise transmission, which is exactly what we want to avoid statewide.
Julie Watts, CBS 13.
Thanks so much for taking our question, Doctor. Actually, if you will, we have two questions. The first is regarding youth sports. Thousands of youth sports athletes are traveling out of state every weekend just to compete against other local teams because California is one of the last remaining states where competition is still not allowed. So 3 weeks ago, you said that updated guidance was coming. We have been overwhelmed with emails from parents and coaches who are desperate for answers. So doctor, can you tell us today, when will they get those answers? And actually, from a public health perspective, are you more concerned about kids getting COVID on the field locally or contracting it while traveling to states with higher COVID rates and then bringing it back here? And then one more regarding the Perkin-Elmer lab. Dr. Galley, CBS 13 has uncovered a surprisingly high number of inconclusive test results coming out of the state's new lab in its first week. Have you identified a problem or a solution yet?
Sure. So thank you for all the questions. So look, I'm a father of 4. My kids are also desperate to find out when they might return, not just to practice and conditioning, but competition as well. So I join the ranks of parents who are concerned and want to see California guided by science and data, but also finding a way for our young people to have that important outlet, that important expression of activity. So I share with many parents, and I know a number of people on our team do as well. So I say that to begin. We are, and I said it before, close. These are not easy guidances to put together. There's not just the competition issue, but there's the conditioning issue. There's understanding how we continue to drive through our equity lens to make sure that there's important broad access to all of these opportunities. And I will say it to people who are close friends of mine, others around the state. I hope that we find a way to hold on a little longer, that we understand that moving into states and other areas with higher transmission is risky, not just for that team, but for the community that they return to. So to answer the second part of your question, or the second question you had, absolutely, we want to find ways to discourage people from traveling long distances to play other teams, play local teams, because it's allowed there. We know that these are difficult times. We are working to make sure that.
You've been watching an update from State Health and Human Services Secretary Dr. Mark Ghaly. As with many other states, California is now seeing a surge in COVID-19 cases. Because of that, several Bay Area counties, or I should say a couple of Bay Area counties, are now rolling back their reopening plans. That includes Contra Costa and Santa Cruz counties now going from the orange tier to the red tier. We also learned Sacramento is going to the purple tier, which is the most restrictive tier on that reopening plan. We also learned just now that no counties in the state are moving forward on that reopening plan.